As Obamacare sets in, some San Diegans tell 10 News that they're being forgotten and they're on the verge of losing their home health care. Reporter Natasha Zuvez has the looming health care cutback that may devastate those who live in remote areas in a matter of months.
Well, the issue here is money. Right now, there's only one main company in San Diego who's willing to bear the cost to send healthcare workers out to these regions in red. Take a look. We're talking about places like Palomar Mountain, Alpine, and Campo out here in the east. These are the homes of the injured, disabled, and elderly San Diegans. But now with a looming cutback under Obamacare, this company says they will no longer be able to send anyone to these regions.
Hours away from city bustle, Julie Nunez's Campo home is surrounded by nature. Chickens, goats, and horses roam her property, but she hasn't seen outside her walls in more than a month. A riding accident has left her with a badly broken leg.
I remember getting on my Mustang, and then I remember waking up on the ground.
Then the pain set in.
Had no idea that it was going to be that bad.
8 screws and a metal plate later, Nunez is unable to walk, use the restroom, or shower on her own. A worker from Mission Healthcare comes out to her house to provide these vital services.
It's nice to see people, hear voices.
And to make sure her wound is clean.
Thank goodness for them. I don't know where I would be without them.
But Mission Healthcare says patients like Nunez will likely soon lose their care.
I myself am a clinician, and it makes me sick to think that we are no longer going to be able to provide care for people in outlying areas.
Buried in the 11,000 pages of regulations in the Affordable Care Act, we found Section 3131, which essentially describes a drastic 14% cutback to Medicare home health funding. In September, 142 members of the House wrote a letter expressing deep concern with this major cut, saying many who live in underserved areas will be devastated.
This will be catastrophic for them. They'll be forced to get in a car and drive 30 miles to the nearest emergency room, where the costs will skyrocket.
For Nunez, the nearest ER is more than 45 minutes away.
It's sad, but you see that back here all the time. It's just like we're forgotten about.
Natasha Zuvez, 10 News.
This 14% cut to home health care goes into effect in January to be completed within 4 to 5 years. To give you an idea of how many San Diegans will be affected, Mission Healthcare alone visited more than 30 patients in outlying areas just this week.